Indonesian mental health care system is awful. I'll tell you why. Our mental health care system is facing significant challenges impacting its access, efficiency, effectiveness, and overall impact on society. But what exactly are these challenges? Indonesian mental health care operates under a decentralized system. Each regional government manages their own system. But the thing is, regardless of the law that states its provinces need one mental health hospital, but 7 provinces still haven't established any.
But why is this important? Mental health is crucial because it affects everything in our lives. Poor mental health weakens our immune system, raises the risk of chronic disease, and hampers our ability to communicate and connect with others. If the future leaders of our nation's Gen Z are in ongoing mental health crisis, how can we expect them to function effectively at all? Prioritizing mental health is crucial for our overall well-being and future success for society. Our system of accessing mental health care often involves a RAF system regulated by the BPJS system. Patients must first consult with a general practitioner at primary mental health care, and they will get RAF letters to access psychiatric care if they are deemed needed.
Now, this is already pretty problematic. The stigma and lack of mental health literacy makes the system have delays and complications in receiving appropriate care. A study from the National Library of Medicine shows that many individuals report being misunderstood or even denied help by primary health practitioners.
A few studies on the potential hazard of primary GP treatment, one of which a study from Australia, suggests that only 26% of Australian patients with common psychiatric disorders receive an evidence-based intervention. Compared to professionals, GPs were less likely to give evidence-based or minimally adequate treatment to patients. And it's very obvious in Indonesia. Only 9% of patients with depression receive evidence-based treatment. Additionally, Indonesian treatment used in facilities need to be improved as well. The lack of quality treatment is overwhelming. And not only that, mental health professionals are sparse and are spread unevenly. There are barely any mental health care facilities in rural areas, and the long-distance costs to healthcare facilities are expensive, not to mention the cost of the care itself. And furthermore, there's a problem with pasung. It is a practice in Indonesia where individuals with mental health issues are restrained and confined. This is the result of lack of mental health literacy and the general accessibility of psychiatric help.
Also a major problem with suicidal prevention. Indonesia lacks a national suicide prevention strategy. Individuals attempting suicide can't access universal insurance, so doctors often remove any indication of suicidal intent, and also underfunding is also a major issue.
Well, there are many ways to increase our awareness on mental health.
Many Indonesian provinces lack mental health professionals and facilities. We could solve this. Example, Yogyakarta. Yogyakarta is the only city having placed psychologists in all 80 community health centers since 2010. It also has mental health learning centers like Satu Nama's department. There is also implementing more school-based interventions to promote awareness, one of which is peer lead modeling programs. These programs allow students to share diverse perspectives and understand subject matters better. For example, in Shiraz, a peer lead training program boosted self-esteem in female students. In the US, there is an activity called Mental Illness Awareness Week, which consists of psychiatry residents visiting secondary schools and spoke to class students in discussion with young people living in schizophrenia, reducing stigma. Implementing similar programs in Indonesia, where schizophrenia is common, could be really beneficial. Moving on, we could also consider more individual training programs, like mental health first aid in Australia. It's a 12-hour courses teaching regulation, causes, and treatments for various health issues. However, we still need to consider the effectiveness and cultural relevance of these interventions when implementing them, which is a big lot for most of us, including me. We aren't big decision makers, we're just people, but we could still raise awareness. You can always make flyers, videos like this, websites, or just simply sharing this type of information to your family and friends. There are so many ways, and always, change starts with you. Additionally, if you're a Surabayan Cikal student and are planning to change your mental health condition, consider registering to our peer counseling session. And that's a wrap. Thank you.